Hi, I'm Dr. Shauna McKinney. I'm a reproductive endocrinologist and fertility specialist with Pinnacle Fertility here in Tulsa, Oklahoma. Today, we're talking about something that's often overlooked in the fertility journey, and that's how the medications and the supplements that we are already taking may affect our fertility. When you're trying to conceive, I believe that a medication review with your specialist is really essential. While most drugs are safe, some common ones can interfere with a delicate process of reproduction, and you simply may just not be aware. So today I want to talk about 3 different classes, prescriptions, over-the-counter drugs, and then supplements. So let's start with prescriptions. Probably the most common prescription medication that I see that patients are already on when they come into my practice are my male patients who have been prescribed testosterone therapy. Testosterone in any form, injectables, gels, pellets, can shut down sperm production. So that's really crucial that you let your fertility specialist know that you're taking that medication. Another one is spironolactone. Spironolactone is a medication that we use in women with polycystic ovarian syndrome that maybe suffer with acne or abnormal hair growth. And while great for the treatment of those conditions, it just isn't safe in pregnancy. There are other medications that may have more indirect effects on our fertility. So things like antidepressants or blood pressure medications, those may cause issues with the sexual function, thereby causing fertility issues in that way. Let's jump to over-the-counter drugs. So over-the-counter medications, clearly the most common one I see, again, would be like ibuprofen or our non-steroidal anti-inflammatory medications. And while these medications are typically fine in general, regular use or use right around the time of ovulation can actually cause issues with how a woman ovulates. I'm going to jump into supplements now. Supplements, to me, the whole market is kind of like the wild, wild west. I say that because that market isn't regulated by the FDA like our prescription medications are. And so what this means to me is that I can't always trust the purity, the dosage, or the other ingredients listed. I think when I talk to patients in the office, clearly a prenatal with folate is just non-negotiable, right? And then other supplements that we think about, we want there to be some evidence behind that it helps with either sperm or egg quality. So things like CoQ10 and omega-3 fatty acids, I think fall into that category, and I think can be a nice adjuvant therapy while you're undergoing fertility treatment. So I think to end, what I'd like to say is that we're all very unique. Our fertility journeys are very unique. What may help one person may not help the next person, or maybe could even hurt. So I think medications and supplements are just one piece of the puzzle, but an important piece. So the single most important step that I would say is for each patient to make sure that when you come in to see your provider, that you're really bringing a complete list of the prescription medications, over-the-counter medications, and supplements that you're taking so that we can know that at the time of your very first initial fertility consult. Happy holidays.